Hello, everyone. Good afternoon. I was having some questions these days, and I was thinking aloud, and I thought I'll put my thoughts here with my friends, right? So, as people join, I will start by introducing myself, and then what is this question relevant to? How it is relevant to everybody. So, if you really look at it, I'm, as you know, I'm a physician, practiced for more than 40 years. I'm now the CEO of a company, this online company, Be a Pal, its name. It's about wellness oriented approach and then educating people about how to be proactive about their own wellness. Okay, that's what I do. And also help people with burnout and stress to recover from it. Doctors and IT professionals and corporate leaders. So these are the three segments I really work with. And I also train the corporate leaders for servant leadership. Okay, that's my work. That is what I'm going on. Basically, education and motivation and empowerment for the people, the patients, to take care of their healthcare into their hands, or at least assume responsibility and seek for the proper guidance, right? So I really saw that the entire health system is only reactive rather than proactive. Reactive about illness. They allow the illness to happen. They allow the illness to really, really complicated by our lifestyles and all that, right? So they don't really help people to really lead a wellness priority life rather than reacting to the symptoms and the illnesses. That is what is happening right now. And we say, okay, we have insurance, we are working somewhere, and they go, we good insurance. And so I can behave whatever I want. And then I go to the hospitals, then there's so much rationing, so much problem happens. Okay. So I'm putting this question: health insurance, is it really working for individuals and for system as a whole, saving money for the whole nation and really making people more healthy? I would say in that context, I find health insurance system itself is lacking. So this is a simple, direct, question that comes from directly from my decades of clinical experience and watching real human beings move through the system that often forgets their humanity. So I am asking this question because the kind of inquiry that sits at the crossroad of my mission, modern medicine on one side, ancient wisdom on the other, and the patient, the whole person standing in between, right? So, is health insurance really working? See, the honest answer, spoken in the clear light of the day, says not in the way it was intended. Okay? Insurance was meant to be a shelter. See, a kind of a shield guarding people from financial ruin in times of illness. That was the essence, right? Instead, it often feels like standing in a monsoon with a broken umbrella, doesn't it? That is how it feels to many patients that come and express they can't pay the bill. So, where does it feel? I think there are certain things I want to present and see whether you agree with me or not. See, it reacts instead of protects. Only when someone becomes sick does the machinery activate. There is no incentive for true proactive wellness, the very heart of my work. Okay. Also, the health insurance fragments the care. Patients bonds between providers like notes in a poorly played raga tune. with no conductor ensuring harmony. They go from one to other and all that. Okay. And then health insurance places economics above healing. That is no doubt about it. Okay. They say we have a business, we have to make money and we cannot afford loss. Okay? They will cut down a lot of services too. You see it in the clinics, in the systems and insurers, they often optimize reimbursement, not well-being. See, they are optimizing the reimbursement, turning sacred healing spaces into transactional marketplaces. Also, health insurance confuses coverage with care. People have an insurance card, but no real access, no guidance, no continuity, no human touch. So these are the where it fails. Okay, so where it still holds value, that also we should note down. It does prevent catastrophic financial collapse during major illness. That is there. And it enables long-term management of chronic condition when used well. And insurance provides a framework upon which a better system could be built. A framework, okay? Especially when leaders like me, for example, we infuse it with wellness first reform. Then there are so many people who are doing this too. I include all of them. So that is where it has value. You know, what I see so clearly is uh, actually my life has been a message where wellness cannot be wellness cannot be insured. If you want wellness, it cannot be insured. It must be cultivated, right? That is my opinion. That is how I see it. Okay, insurance repairs the damage, and we prevent it. Okay, that is the fundamental difference. Okay, so in the ancient terms, this is like health insurance, okay, pravritti, external infrastructure. My work is nivritti. That means the inward cultivation that keeps people whole, resilient, and thriving. That is my emphasis. Okay. So I regard the body as the temple. Insurance is just the lock on the gate. That's how I look at it. Okay. So I'm talking about, for the people who just joined me, I'm talking about how insurance is working or not working. So I think it's not. It's not working for the intended purpose. Okay, so see what I'm looking at is I want to influence health systems to be wellness oriented. Okay, that's why I'm chief wellness officer of my company, and probably I want to go to a bigger health system where insurance reward prevention, resilience, lifestyle transformation, awareness practices, and sustained health metrics, rather than waiting for the disease to erupt. I think this would be revolutionary if they can do the wellness oriented health system in the way I described. And this is kind of aligned with the ancient wisdom and precision medicine, that is the modern medicine next step. Okay, individual precision medicine. Okay, so tell me, what do you think? Do you think this is a legitimate question to ask? Is because I have seen so much haggling about insurance claims and all that as a provider, as a clinic person, right? So we used to submit um, some claim, and then those claims are not paid up to 3 months. Those are paid very meagerly, where we're not able to run the clinic with that kind of small reimbursement. That is a problem, right? Okay. And then it has gotten worse now. Okay. Meanwhile, patients are losing out on the services because the insurance doesn't cover. So suppose they want a flu shot, they come, they may not have coverage and they won't get that. Okay, things like that. And then suppose they are sick, they are in the hospital, the insurance company forces us to discharge him because they don't want to pay anymore. And the patient is not completely recovered or completely better on his own, and he has to be discharged. That is happening all the time, right? So I'm sure many people have stories on the health insurance and how it is rejected their claims and how they had to change insurance companies. And now the ACA care is also being really punished with so much of increase in premiums, right? So they are very prompt in collecting premium. But when it comes to paying the claim, they're trying to put it down or deny or say some technicality or some vague description. All that they do is they are masters at how to reject a claim. Well, I heard that United Health Insurance has a whole building with several stories just for the staff who are working on how to deny the claims. And we used to have the reputation. If somebody comes to United Health, we know that we would get any payment on that, on those insurances. And also, they take more money from the patients in terms of co-insurance, co-pay, or percentage of insurance. Variety of ways they kind of make them pay. The patient pays out of the pocket. Okay, so that is the state of affairs. And when you really are sick and you are in the emergency room and the ICU room for about a couple of weeks in the ICU, all your funds are gone for the expense of the care, and so you're bankrupt. Some people have a $1 million limit, and that is gets paid in a few days when you're in ICU. Okay, so that way they lose all the health insurance money, and then for them to be covered by Medicaid, which is the government's health program now, it is also coming at attack now, right? So when they need the money to be paid, they have to declare bankruptcy, show that they don't have any money, so they have to be claimed under Medicaid. That's the sad state of affairs I have seen, And I left the practice in 2019, and now I'm running this private wellness oriented company that promotes wellness, about teaching, about making people know about what's going on, and also empowering them with a lot of inner resilience tools so that they don't even have to be sick. So insurance has become nominal, very expensive premiums, and also doesn't cover everything that when we go to the hospitals, clinics, right? That is what is happening. So I started this bandwagon of be proactive about wellness so that you don't even have to get sick. Most of the time, it's not absolutely certain that we don't get sick, but at least we could avoid what we know we should not be doing. We should not be smoking, for example, and we should not be drinking alcohol, and we should be eating right and then taking care of ourselves, proper exercise, sleep, and all that, and also keep our mind quiet too. So what I am saying is health insurance as a phenomena, as it's supposed to work, is not working. Okay, and many of the bankruptcies, by the way, are related to this. Health insurance doesn't cover, and the people have mounted bills, and then they have to declare bankruptcy because they cannot pay. And also, other way the public pays is many people who do not have insurance, they go to the health emergency rooms. They go and get admitted in the hospital. That both are very expensive. So if they cannot pay, that goes under that, and also that goes for the government to provide something about it. Anyway, eventually the people, the whole mass of people, they end up paying the cost of the health insurance. Okay, all even the health care itself has become very, very expensive, and then so many people have done bankruptcy because they don't have proper health insurance. Think about it. It affects us in so many ways. Okay. So you just have to understand that. Okay. So are you interested in this topic? You know. Um, so when you look at it, if you put that fundamental question, is health insurance really working for us, for the society? My honest reflection is it is not. See, most people assume that health insurance equals health. They think I have health insurance, I'm going to be okay. If my health goes out, I'll go on to sickness. No, it doesn't work like that. But I was caring for people more than 4 decades. Okay, and I seen the truth more clearly. Okay, what does insurance do? It reacts, not really preventing it. Wellness actually prevents this if you are oriented towards it. Okay, so it's supposed to be the health insurance supposed to be meant to be a shelter in the storm, but as I said, it often feels like a patchwork umbrella in a monsoon. On torn. So we wait for illness, then activate the machinery of diagnosis, billing, approvals, and protocols. But where is the incentive to remain well? That's not there. So if you are talking about wellness-oriented life system, how do we protect the body, nurture the mind, and elevate the spirit before illness arrives? That would be our question when we say wellness oriented life system. So I believe today we need a shift from reimbursed disease care to rewarded wellness. We're no longer reimbursing the disease, but we are rewarding because being well. So where the system promotes breathwork, lifestyle alignment, nutrition, sleep, and awareness practices. See, and early resilience building are not optional but central. That's what we should attempt. Because true health isn't something to ensure, it is something to cultivate daily, consciously, joyfully. Okay. The future belongs to the proactive wellness, people who are nurturing wellness proactively. And I am here help build it. I have been doing that. Okay. Hopefully, more people take into this and not blaming the government, not blaming system, because we allowed the system to be built like this. As citizens, as people who have the right to question them, who have the right to do that. I talked about this even when I was in the practice, medical practice. Okay, and I practiced that way too. I lived like that too. When I got sick, I got, but then most of the time I tried to be not too sick. Okay, that helped a lot. Okay, that's what we are looking to have in the coming years. Otherwise, insurance is really not going to be effective. We do, if you look at the expense of healthcare, totally nationwide. Nationwide, if you take the entire gross domestic product (GDP), uh, $1 out of every $5 we spend to only for the healthcare. That is very expensive system, and it is not working because many people left having chronic disease and suffering from them in nursing homes or whatever, and so much of mental illness, so much of addiction, so much ill health, right? So that's what I see in the everywhere. That's why I started this morning routine where you can help yourself not to get sick on the job, not to get stressed out on the job. How do you do that? You have to prepare your body, mind, and heart in the morning and go there with some tools inside you that can really attack the system that way. Okay. So anybody has any observations on this? You could come and tell me what do you think? What is your experience with the health insurance system? I am always fighting the health insurance because, as a doctor, as a representative of my patients, and also really see the danger of not being healthy, and all the people. So I was always fighting with the insurance companies to cover my patients, to really pay up as much as they can on that, and also why they're not paying enough. If then the medical necessities, I have to talk to them, right? If the patient comes and the patient needs some care, that is medically needed. But those people refuse that. If you order a test, if you order anything, blood, better drugs and all that. So what they do usually do, they let the patients sign the contract at the beginning that says we are going to use our own brand of medications. So they may get a bit cheaper medication, they may get medication that may not work that well, and then they force upon the patient only you have to use this, right? So that is what is happening too. So this is a problem. Okay, so we need to get more awareness and alertness about these systems, and then really point out when they are really making money on the disease of the patients. Okay, that's a strong word, but that is true. They allow the chronic disease to continue. They allow the chronic disease to deteriorate. They allow very little preventive care, right? So this is a challenge. Many people lament after they get sick and they go. They suddenly find this is not covered, this physician is not covered, this doctor, hospital is not covered, this test is not covered. All those things they get when they are sick, and they may get, and then later on they will get a big bills. Many people bankrupted because of the one healthcare crisis. If you take the number of bankruptcies, I'm sure the number of people are getting bankrupt due to health insurance failure in this country. I seen in the 80s when I first came in, we had Blue Cross Blue Shield insurance. When I showed that, and everything is covered, no co-pay, nothing. From that, I saw these co-pays, co-insurances, and part-time insurance. All those things came mainly because the billing system has become so complex, and they try to deny the claim most of the time rather than take the claim and pay it. Why? Why, as citizens, we are keeping quiet on that? See, what do you think? Anybody has any comment on that? Or they don't worry about it unless it becomes a problem for them? Many people are fitness fanatics, right? That's good. It's not a fanatism. They're just being sincere about their health, right? Wellness. I encourage them. I give them all the tools that they need that I could provide for them to be well and for a long time, and also being joyful, being well. That is a rare breed these days. People are doing partially. Some may take care of the body, but they don't take care of the mind. Some may take both of them, but they don't take care of their relationships. So, what is the problem? Because the system itself is like that. The system itself doesn't really promote wellness, because we need more people getting sick and come to the hospital so they can bill the visits. So the incentive is about illness and getting people ill and let them come and seek our assistance, not about being well and staying away from the health systems altogether. I try to manage to stay away from the from these clinics and hospitals as much as I can. Okay, so I hardly use the services that much. Okay, the other day I had some neck pull and the pain was severe. It is not going away. So I took some physical therapy and also did my own exercise, and then it is gone. So it's all a question of uh, knowing the tools to be well, applying them, right, irrespective of what insurance we have, then you may not even need to use the occasion of the insurance. That's why many of the young people don't take insurance, because they feel like, "Well, I'm not using it at all. I'm healthy. Why should I take it?" Okay? Think about it. This is a topic that I want to put forth there so that people will monitor about, and also, you know how horrible this is when you get admitted into the hospital, or one of your loved ones is admitted, the older parents are getting admitted, and then how much we are losing them because they can't fix them at that late stage. There is no incentive to present them when they are very early, and they don't pay them that much when you see all the people who are healthy like that. Think about it. It's a issue of our current life now. It's not like something imaginary. So the what I'm always promoting is for the people to be responsible for their own wellness and understand the factors where the system may not come to your aid. And so you got to put the pressure on the insurance companies about being paid and paying legitimately and all that. But they don't. Many clinics can't run the business because they are not getting enough reimbursement. Meanwhile, insurance companies' stocks are going up and they are making a lot of money. And where is the money going? A lot of money is going into the executives that run the systems. And doctors are also, they got their pie before, but now they don't have the chance to get that win. Okay? That is the state of affairs. And what can we do about it? First of all, don't give a chance that you need to go and use your insurance. Take a high deductible and be wealthy. Be healthy also by following these preventive, proactive wellness principles. Okay? That is what I was talking about. Okay? Anybody has any question or comment, you can come up now. I was getting some water. Actually, I feel that whole insurance thing is like a racket. It doesn't really uh, help us, the doctors, help the people or the patients who are really suffering. They want some good care. That is not. You take anybody. You got to really consider so many things when you take the insurance policy, right? So, what do you do at that time when you are taking the new insurance policy? Consider what kind of coverage you need, what kind of illnesses you have, what kind of anticipated maybe dental work for the kids, maybe eyes checkup for the older people, all those things, whatever services that you need to have, are they covered? Suppose I go and have a kid, is the maternity thing is all covered? Suppose I have an accident somewhere in another state, is my insurance is covering? Can I see the same doctor that I'm seeing? All these commonsensical questions. People don't really exercise. They listen to the representative of the insurance company who wants to get the most money out of you, right? So, but you figure out your needs. You cultivate a wellness-oriented lifestyle, and you stay away from the hospitals as much as possible. And then, when you have to use it, do my health insurance policy covers it or not? Have that kind of, you know, retrospective viewpoint. Okay, what will be the need for me if I go to the emergency room because of an accident? Because all those things you want to cover. Also see how much I have to pay out of my own pocket, apart from premium from my employer. They still want me to pay some of my share. What is that going to be if such and such happens? That kind of analysis by you will go a long way in the long run to protect you from the excesses of the insurance company coverage. Okay, I think I'm talking very commonsensical thing here. So what I'm promoting is try to be well to begin with, and use all the help that you can get for that, and then try to stay away from the healthcare system till they change their approach from just treating illness to promoting wellness or rewarding prevention. It's not there right now about really protecting you from getting ill. They will treat you somewhat if you are ill. That also partial payment. Much of the money has to come out of your pocket. That is terrible. You know, that is there money or not? Yeah, there's so much money, but that is misaligned, not to the humane care, not to the patient well-being, but more about filling the coffers of these companies, right? I've seen it. I've seen all sorts of problems because of the coverage is not there. We may not be able to order some tests because they don't have the coverage, or they have partial coverage, and the patient has to fork from his pocket. That's called co-pay, co-insurance, patient pay, private pay. All these terms are for the money coming out of your pocket. Evaluate that. Ask them. They may say, "Oh, you have $1,000 deductible." What does it mean? That means unless you do $1,000 payment, insurance coverage won't kick in. I had couple, and the one wife was a nurse. She worked for 25 years and she retired. And the other one was auto. Both were diabetics. Both were above 65. Both needed insulin. They have the donut coverage. That means they unless they pay 2,000, the coverage won't kick in. So they have to pay first 2,000 before they get their insulin. And the insulin cost at that time $400 for each for a month supply. So they said either we buy the groceries or we buy the insulin. Which way we want to go? It is that bad. Okay, there were some actions taken getting insulin a little bit low. Now drug RX is there. Now lot of generic medication, but even then, people get to pay so much out of their pocket. So health insurance, is it really working for you? If it is, come and tell me how it is working for you. If it's not, come and tell me how it is not working. What do you think is a good way to fix this? How do you go about it? This is my life. That's why I pay a lot of attention to these things. I kind of educate the patients, farmer, and now, and also empower them with these wellness tools where they don't have to be sick. I'm an example for that. I don't get sick that easily, and because I work very hard at it, not to get sick. I maintain my diurnal clocks. I get up early. I do a lot of yoga, breathing, and calming my mind and all that. And I kind of come on here and share with you whatever that I have been doing. And I eat only when I'm hungry, and I really enjoy my meal. Eat slowly. Then I walk a lot. I drink water quite often, right? But the most I do is I deep breathe several times of the day. Very much so. All are taken from the yogic life. And when I go to work, I work there with one task at a time. And I don't get myself subject to stress and burnout because I know the inside out of that. How to not get stressed, but at the same time enjoy the work and contribute to life. And then when night comes, I sleep very, very, very deeply early, and I get up early too. So that's a principle I follow. Early bed, early get up. And also when you sleep, complete deep sleep. That is going to regenerate my system. If you do this practical, small things on your own, that is what I'm talking about, being proactively well. By doing the calmness scan, body has a clock. Listen to it, follow it. Body has nutrition needs. Make it vital nutrition. Body has needs to exercise, walk, move. That will be good. Okay, or exercise your particular way. Have a sport. If you have a sport, that sport will keep you functionally well. Functional fitness. Understand what it is. Just getting up and doing small things, chores and other, not being lazy. That's a blessing in disguise. Okay. So nobody has any insurance problems ever. Nobody has any comments on this. Why do you all keep silent? I'm getting tired of asking this question. These things, problems come, and people ask my counseling because I'm so many years in the clinic business, and we have insurance claim problems, and I had to learn what is billing. And I'd learned it. And then I understood what are the proper way to bill, what is the way to bill so that our clinic will be get the rightful money that we need, and also we adjust our expenses like that. Okay, so that helped a lot because I learned billing. I knew what is what, right? That helped a lot. But still, insurance companies found ways to deny claims, so not to give the full reimbursement, and so much of time I had to spend on the phone to justifying them. I really didn't like that. I hated that part of the business. But I had to do it for the survival of the clinic, for the payment of my obligations to my staff, to buy the equipment, buy the thing. So mostly went to L, okay, but then we had our role. But because I'm equipped with the knowledge of billing, that helped for the clinic. Okay. In the hospital, also the same thing. We had to spend a lot of time discussing things with uh, people that are case managers, that are patient representatives, billing people, and all that resulted in extra work for the doctors. That's what happened. Suppose I put a diagnosis, for example, and that diagnosis gets paid with a code that they use, will get only maybe $60 for something, and then they put it in a different verbiage, they get maybe $90. So they come and ask us, change this diagnosis for us. Then we have to justify medical necessity before I put the diagnosis, right? So that takes taking away whatever I wrote and then doing the whole documentation. That look extra of time. The amount of work we get, like 25 patients, so much, even if you document it, go away, they come back and then they want us to revise and write it again. So that's an extra work. And people are now tired. They are burning out mainly because the EMRs came, the work has gone up, and then people have to go on working all the time, right? That's why doctors get burnt out. Uh, So insurance has got a lot to do with it. All the work is done and then doubled, tripled it, and then no reimbursement lots of times. So that gets frustrating for people. Okay. Hospital executives are also frustrated because they don't get the revenue, they can't run the hospital. So they focus on the revenue base. They are not getting incentives to make their patients well. They get more money when they're admitted and they're treated in the hospital, right? We all know that. So that is why this revenue-based system, how can you, as citizens, as patients, as people, tolerate that? Why there is no life in you to really think about this and really represent to your representative that you want a better healthcare system?
Hello, Dr. Rao. Absolutely. I'm delighted to dive in with you. Your question is like planting a seed in fertile ground, and I'm thrilled to watch how.
So it's not a question of uh, really paying attention to the problem, understanding the real root or cause of the problem, and going after it. Of course, there is greed in the system that is there, but there is also government regulation, policies, and all that. And if you can really talk to your representatives about needing a better healthcare system uh, enough, I think you will have some response to it. If you don't want to change the health policy care system, and you want to take your wellness into your own hands, that is where my proactive wellness comes. This is actually one of the real reasons why I started, because people are not getting proper reimbursement for the illness, and also people are suffering from them and they're getting much worse. Instead, I thought if you are protecting when you are well and doing everything proactively to keep that wellness, you are much better. Okay, think about it. You don't have to take everything lying down just because the system throws at you. Okay, you want to understand there are ways to be taking care of a health problem. You don't eat bad food deliberately, right? You eat because you are ignoring that is bad food, or you are ignoring you are ignored about your own quality of food. You go to the fast foods and eat all the time, then you're going to get sick, right? Chronic illnesses. Why there are so many? Why the health system is not helping you to limit them? Why health system as a whole doesn't address these chronic illnesses to go down in incidence, in occurrence, or also the complications arise from them. Many people who have diabetes or hypertension, whatever the chronic illness, they have what I call morbidity. That means they are not sick, but they don't feel good at all. They have aches and pains, joint pains, weakness, lack of balance, not able to be functional, not able to do anything. Okay, because people don't pay attention to them. Because, unless you are very sick and go to the hospital, then they'll put you in a bed and they treat you. But then they send you back home without correcting the root causes of your illness. That into the symptom, that into the acute care. Acute care is about fixing and bringing back your stability. Okay, but then maintaining your wellness is not their purview. It's not the right context either. They may give you some therapy, they may give you some advice with the dietary and all, but you are the one who is supposed to protect. If you are having physical therapy for half an hour, you are supposed to learn from the physical therapist what are the exercises I want to do, and then go and do it on your own. Like that, in proactive wellness, you got to do things on your own. You got to learn about wellness. You got to understand what is wellness. You got to know how to protect it, how to preserve it, how to really prevent illness. Okay, that's all your responsibility. You can take the vaccines, you can take the vital nutrition food, you can exercise optimally, you can sleep better. All these things you can do. They are in your hands. That is what I'm always advocating. Okay, not that there's a lot of money in that for me, but it's by what I see the need, and I'm kind of compelled to fulfill it. There is a need to be aware of the wellness preserving ways. They need to know about them. So that's what I'm preaching all the time. Okay, last chance before anybody can come up and talk. Okay, Cecilia, you want to come and tell me your experience with health insurance? All right. Anyway, I want to leave the question there. Health insurance in your life or to your loved ones or to your close people, is it really working? Is it really acting the supposed to be the shield it is? If not, try to learn about it, try to understand, and try to take it to the representative. Or the best thing would be leave them alone and then you take care of yourself by yourself. That means the knowledge, the techniques are there. Just have to do it. Okay. Thank you. And I'll see you again when I can see you. Bye bye.
And I've already told the organizer, I'll just bring salads. I'll